I dreamed of being a professional athlete. Basketball was my love and my passion, and it was just the sport out of all the ones that I played that I liked best. My name is Fred Hoiberg. I'm from Chicago, Illinois. I'm the head coach for the Chicago Bulls. I spent most of my life in Ames, Iowa. I went off and played 10 years in the NBA, spent 4 years as a front office executive with the Minnesota Timberwolves, went back to Ames for 5 years, and this is my first year here in Chicago. Well, I was really lucky. I had no symptoms at all. I knew I had an abnormal valve. I knew I was born with a bicuspid aortic valve. I found out about that in college. So I'm in Minnesota, and our team doctor, when the season was over, recommended that I go down to the Mayo Clinic just to be sure that everything was okay. I was diagnosed with an aortic aneurysm back in 2005, and that was due to the bicuspid aortic valve. Talk about a kick in the gut. I was 32 years old. I was in the prime of my career. I just led the NBA in three-point shooting. I basically was playing on the court with a ticking time bomb in my chest. It was very emotional. I guess the first thing you go through is denial. I've got to get a second opinion here. It can't be true. I don't feel anything. But once we talked to other doctors, I needed that surgery.
In the general population, about 1.5% of the people have a bicuspid aortic valve, and many of them will go on to require some treatment for it. Coach Hoiberg had a couple of complications at his first operation.
But I still thought about playing. I wanted to go out on my own terms, and I did everything possible to get myself back in great shape, but I had 4 young kids, and I just decided that it was time to move on to the next phase of my life. This last year, it really kind of took a turn for the worse, and doctor recommended that in December I should really consider having the valve replacement surgery.
At his first operation, they tried to spare the valve, keep the valve leaflets, and just replace the aorta around it. After several years, the valve failed, and he went on to require another operation.
I tried to talk to as many people as I could that had been through that operation, people that had a porcine valve, also people that had gone with the mechanical route. The thing that was most encouraging to me about the mechanical valve was that it was hopefully going to be my last surgery.
Even if this was his first operation at 42, he still would be looking at reoperation and potentially another after that, and maybe even another after that. Tissue valves last longer in older people and less in younger people, so that next operation could be coming quite soon.
I didn't want to put my family through the worry and the concern that's tough on the family when you're in the operating room with a surgery that complicated.
The Onyx valve is a genuine innovation, although it's been around for 16 years, and it's the only mechanical valve that I've implanted during the last 14. We demonstrated in a multi-year study that the valve could be managed at a much lower dose of blood thinner, of warfarin, and as a result, there's a dramatic, significant reduction in the complications related to the valve compared to any other valve, any other mechanical valve, and any tissue valve.
I couldn't be happier with everything involved. First of all, getting the mechanical valve, and second, getting the Onyx valve. But the way I feel now, after the valve replacement, I feel like I did when I was playing. I feel great, and I'm thankful I got the valve that I did.
The innovations of the Onyx valve, its performance characteristics, its low risks, are very, very impactful because he's an athlete. He needs to be able to call upon his heart, his cardiovascular system to function optimally. Characteristics of the valve allow for that, and it allows for that permanently. That won't change. And the
big thing, going into the surgery with the tissue versus the mechanical valve was I didn't want the reoperation, and having to go through and be on the warfarin. Now I've been on it for, I guess we're going on 4 months. It's really not that big a deal.
The Onyx valve really represents our finest convergence of technologies. The Onyx valve provides us the opportunity to avoid reoperation. It gives us the opportunity to manage the patient a much lower dose of blood thinner, which dramatically lowers the complications. And that is following an FDA-approved trial that demonstrated that we could do that and do that well.
I think the only limitations really that I have is they don't want me out, like playing football, things like that. I can still go out and shoot with our guys. I'm able to do any cardio that I want. My 3 boys, 1 in high school, 2 in middle school, I can continue to be very active with them, and really that's what it's all about. Coach
Hoiberg is doing exceptionally well as he goes into his first season as head coach for the Chicago Bulls, and he's going to be able to keep up with his team and keep up with his players and enjoy himself. So I wish him the best of luck.
People that are about to go into a surgery, the big thing is being prepared. become an expert on the heart.